To say that a patient has an acute myeloid leukemia just isn't enough. You have to go deeper than that and really dive down into the subset of acute myeloid leukemia and really which characteristics of that cancer can be exploited to attack it, to treat it, to have the best outcome, to have treatment without major side effects. And so all that's rolled together, and so it's really a comprehensive approach. Yeah, really we meet patients, and oftentimes it's at their worst, so they're coming through the emergency room and they've had bleeding, they've had a bad infection that didn't respond to antibiotics, and so really it's off to the races to get a diagnosis quickly. We work with our interventional radiology colleagues oftentimes to get a tissue sample and get a diagnosis really quickly, oftentimes within 24 to 48 hours. And so when we have to give patients the bad news that an induction therapy session often means a hospitalization of 4 weeks at a time or longer, at least we have good news as far as, hey, we have a plan. We have a plan of action. We know how to attack this cancer directly, and we can do it in a personalized manner. And that's something that a lot of patients and families appreciate. So every patient is treated differently depending upon their cancer type. And really, I need to know from our pathologist exactly which type of leukemia, lymphoma, myeloma, or different hematologic disorder or blood-borne cancer they have. That way we can come up with the most precise treatment plan and really directly target their cancer type and kind of individualize that for their cancer type. There's such a quick turnaround. We need to start therapy ideally within a few days if we can. But at the same time, we have clinical trials that are more nimble. They're able to come up and come into action more quickly for patients. And so we have access to the same clinical trials that a patient could get at Mayo Clinic, for instance, and a lot of other academic centers from around the area. That's gotten easier these days because a lot of these big clinical trials want to have more patients from a community center because they recognize that that is basically as close to a real-life situation as you're going to get with a clinical trial. We've gotten down to the molecular data, the DNA data, the smallest imprint of how different their cancer is than somebody else that came in right before them. And so if you look at that patient, it's hard to group them with that other patient. And so you want to try to individualize that care as much as possible. As you treat different leukemias and different blood-borne cancers, each one's different. Each one has a different signature behind it. You need to know how to treat that as precisely as possible. So with precision comes response, becomes the efficacy of attacking that cancer. We're meeting patients in their early age, in their 20s and their 30s. They have a whole life ahead of them. And so they want to get through that and not just beat their cancer, but have the ability to have a family, to have normal interactions, to not worry about different complications later in their life from the treatment that cured them earlier in their life. First and foremost, you look at this, the question is, can this be cured? Can this be something that I survive from, and not just survive from, but thrive? As I mentioned, having a family, having normal interactions throughout the rest of their life, being cancer-free at some point, not having to see somebody like me, a cancer doctor. Ideally, right, that's my goal for every patient, if I can. And then secondly, they want to know that there's plans for both what we expect to happen in eventualities. So what happens if a patient gets an infection during their induction therapy? Very common scenario. What happens if they require a bone marrow transplant for a more complicated form of cancer, or if their first line of therapy failed? We want to have a backup plan. We want to have a strategy. And we want to be able to deploy that strategy as quickly as possible because days are important. Days are really important.